I am Dr. Saqib, and today we will discuss muscles of the face, muscles of the facial expression. And as we know, when two people meet in a face-to-face come across, the face-to-face meeting of the two people, much impact is carried about by the muscles of the facial expression. So many expressions conveyed by the muscles of the face, like the happiness, sorrow, and the sadness, the fright, and the contempt, and the various all these mixed or expressions conveyed, which we will sum up during the course of the lecture. Which muscle conveys which expression. So think about the muscles of the facial expression. They arise from the second pharyngeal arches developmentally. And of course, the nerve of this arch is the seventh cranial nerve, which is the facial nerve. So this is a motor nerve, of course. It supplies all the muscles of the facial expression. So virtually all the muscles of the facial expression are supplied by the facial nerve, the seventh cranial nerve. So they can be grouped, basically the muscles of the facial expression according to the face layout. So let's you see what is the extent of the face, what is the boundaries of this face. So superiorly, face extends from the hairline, which is the adult hairline, somewhat here. So from this hairline downwards, it extends to the chin, and on the sides, to the base of the mandible, and this auricles on the sides. So this hairline, below chin, the side base of the mandible, and these auricles. This is the boundaries of the face. So you see this forehead is shared area by the face and the scalp. I discussed the anatomy of the scalp with you in the previous lecture. So you can go back to that lecture to see the layout and the extent of the scalp as well. So, and the muscle of the scalp, the occipitofrontalis, discussion of the applied aspects. I will give the link in the description below the scalp as well again. So this is the boundaries of the face. So a overlap of the forehead. Forehead is also included in the face and also included in the our scalp. This is the boundaries of the face. So the layout, you know, these are the all muscles labeled, various muscles. Broadly categorized as muscles of the forehead, which is of course the frontal belly of the occipitofrontalis. Then muscle of the neck, this platysma, muscle of the neck blends with the muscle of the face over here, right? So these are all muscles. And one point about these muscles is that they arise from the bones and the superficial fascia. The muscles of the facial expression arise from the bones and the superficial fascia and are inserted into the skin of the face. And they pull the skin of the particular area of a face and produce a specific expression of the face. Like smile is produced by zygomaticus nature. So this is the layout, right? So as we study, this is the muscle group, muscle of the forehead, the scalp, frontalis, and muscle of the neck, platysma. Then there are, three orifices on the face, but this is the palpebral fissure. So we will make a broad category. So muscles surrounding that palpebral fissure. These are the ocular muscles. We will discuss these independently, separately. And the second orifice is these nasal apertures. So the muscles surrounding the nose, right? Nares. So this is another group of muscles like nasalis. So third very important aperture is this oral cavity, the oral fissure, and the muscles surrounding that, like this is the orbicularis oris. These are the various layouts and all this of this muscles of the facial expression. And this is the muscle of the ear, right? This is the auricular muscles, the three muscles. So we will discuss these muscles separately. This is labeled over here. And at this point, I will not discuss because I will discuss them according to the each and every region subsequently very soon now. So this is the side view of the muscle of the facial expression. Very important muscle over here in the face is this buccinator. You could see buccinator. So this is the table muscle of the face in a tabulated form. You see, this is the orbital group. Orbital group. That is the group which surrounds the eye, like the orbicularis oculi, two parts, palpebral and orbital, and the corrugator superciliary. That is the nasal group, these muscles. That is the oral group, the muscles that surrounds the oral cavity, these muscles. Then this, the muscle, this is continued muscle of the surrounding the oral cavity. And then the other muscle, other groups, these are the auricular muscles, anterior, superior, and posterior. And this is the muscle of the scalp, the occipitofrontalis, with the frontal belly and the occipital belly. This is the table. So the first group, the muscle of the mouth, lips, and cheeks. These are the muscle surrounding first orifice, which is the our orbital cavity. Sorry, this is the orbital cavity. This lips, shape, and degree of opening of the mouth are important for clear speech. Also, we add emphasis to the vocal communication with our facial expression. So several muscles alter the shape of the mouth and lips during speaking, as well as during such activities as singing, whistling, and mimicry. So again, a general word about the muscles. You listen to that word. What is that phrase? That about these three openings, this opening of the mouth, this oral fissure, this is the nose, and this is the palpebral fissure. They generally have one sphincter, and the rest of the muscles are dilators. Sphincter closes that orifice, and the dilators open it. So muscles of the mouth and lips. So they are basically a complex three-dimensional group of muscular slips, which include the following. First is the elevators, retractors, and everters of the upper lip. Then are the depressors, retractors, and everters of the lower lip. And the third is a very important muscle, orbicularis oris, the sphincter around the mouth. Then is a very important muscle, buccinator. So sphincter muscle, which is our orbicularis oris, this one. So it acts as a sphincter, which is the first sphincter associated with the gastrointestinal tract or the alimentary system, orbicularis oris. So it encircles the mouth within the lips and controls entry and exit through the oral fissure. So this is the orbicularis oris. So it is important during articulation, that is during speaking, very important. Here you see these are the oral group of muscles. There are 11 muscles included in that. But now we can focus on that one by one. So first of all, this important muscle is the orbicularis oris. You see, this is the orbicularis oris. This is in the form of an ellipse. This is an oval muscle. And of course, this comes from midline. This is the bones, various. This is the mandible, and this is the maxilla. Coming from them, going laterally, and here, this is the point, going to the angles of the mouth. So this is the orbicularis oris. You can study this table is separately pasted, and you can see this is the orbicularis oris, and it arises from maxilla and mandible in the midline, and from muscles in the area, and forms ellipse around mouth. So this is a point. Its action is it closes lips and protrudes lips. Closes lips and protrudes these lips. So the second muscle over here is the depressor anguli oris. It arises from the angle of the mouth and over attached to the mandible, outside of the lateral aspect of the mandible. So this is the attachment of the depressor anguli oris. That is this depressor labii inferioris. Of course, this is medial to this depressor anguli oris, and these are the attachments. This medial to this attachment of the depressor anguli oris, and then blending with this orbicularis oris. This is the point. This is the mentalis. So I taught you in my lecture on mandible that mandibular is a muscle coming from the mental foramen, that area. It is where it is below the second incisor teeth, and these are the mental muscles, both sides, mandibular. So this is again merging with the orbicularis oris. So then is the rhizorius. You see rhizorius. This is this bone. You know what is this bone? This is zygomatic bone. So it is rhizorius coming from its posterior lower aspect and going again into the angle of the mouth. So then is this zygomaticus major and zygomaticus minor. Zygomaticus major comes from this bone zygomatic lateral aspect, and coming downwards it blends with the orbicularis oris and its medial part. And zygomaticus minor comes from medial aspect of the zygomatic bone downwards and merges with this orbicularis oris over here. So that is the levator labia superioris. Here is the attachment. So levator labii superioris. These are the attachments. You could see from the table going into this side of the medial side to the zygomaticus minor, into all these are inserted into this orbicularis or is blended with that. That is the levator labii superioris alachnesi. Here it is, right? Here it comes, and this is attached to the lateral side of the nose. Then this is the levator angulioris. Here you see, this is the muscle coming here like this. All these attachments precisely are mentioned in this table. I stop here to see. So this is, but all the muscles are not need to be memorized. Few muscles are very important, like this, BUCCINATOR is very important, and orbicularis oris. These attachments you have to memorize, and this action of the zygomaticus major, and to some extent this rhizorius and also the mentalis in this muscle oral group of muscles. Then is this buccinator muscle. So you could see buccinator, right? So it comes from the our parts of the maxilla and mandible, both posterior parts of the maxilla and mandible, and also from the pterygomandibular raphe, right? This is the buccinator coming from the maxilla and the mandible posterior parts. You see a separate picture of the buccinator. Here is the buccinator muscle. You could see here coming from this. This is the pterygomandibular raphe. Here is this pterygomandibular raphe. It's a part of the buccopharyngeal fascia coming from this humulus, pterygoid humulus, and attaching over here to the mylohyoid line of the mandible. So that I also discussed with you in my lecture on mandible. So you can go back and see that attachment. So this is the pterygomandibular raphe. Alongside with that, also inserted is the superior pharyngeal constrictor muscle. So you see buccinator, this is the attachments, buccinator. So here it comes from mandible and maxilla, and you see it is then inserted in the lips as it blends with the orbicularis oris, and their actions are similar. So you see the actions. What does the orbicularis oris does? It closes lips and protrudes lips. I told you already. So what is the action of the buccinator? Buccinator action is very important, and that action is that it does not allow the food to accumulate in the vestibule of the mouth. What is the vestibule of the mouth? It's the area of the mouth, oral cavity, between the outer aspect of the teeth and the inner aspect of the cheek. It's the vestibule. So it presses the cheek against them, and it does not let the food enter into that. So this is the action of the buccinator, and this is speeds by the over the parotid duct. And buccinator also helps the cheek resists the forces generated by whistling and sucking. So this is the muscle of whistling, buccinator. So it is also important in the blowing the trumpet, right? So these are the various muscles over here. These are the 11 muscles on this oral group of muscles. It's all named, labeled over here, a separate picture showing that aspect. So this is the table of all these 11 muscles of oral group, facial expression. There, of course, nerve supply is facial nerve, cranial nerve number 7. The actions are listed over here. This is, I told you again, this is buccinator. Very important muscle. Then we move to the dilator muscle group mentioned. This is the formation of the modulus. Yes, you see, modulus. 9 muscles blend at the lateral aspect with the commissure of the lips. So this is these 9 muscles blend to form the modulus. These are orbicularis oris, the buccinator, levator anguli oris, the depressor anguli oris, zygomaticus major, rhizorius, platysma, and then is the levator labii superioris. So these are the muscles, they blend and form the modulus. I show you the picture of the modulus. Here you could see, this is the modulus picture. You see, concentrate and see what you see. These are the 9 muscles blending at the lateral angles of this orbital fissure, mouth. So they form the modulus, right? And they say, the anatomists, we anatomists, this is responsible for production of the dimples. And those people who have dimples, this is due to this modulus. Then we comes to the orbital opening, and that is the palpebral fissure, muscle around the palpebral fissure. So function of the eyelids, that is palpebrae, is to protect the eyeballs from injury and excessive light. And the eyelids also keep the cornea moist by spreading the tears. So as they blink, the eyelids, they keep the cornea moist by spreading the tears. If they don't do this, the cornea gets ulcerated, like it happened in Bell's palsy. We will discuss very soon. So the orbicularis oculi, right? So this is the again that mentioned, that is assists the flow of the lacrimal fluid, the tears. So it has 3 parts. You see the picture. The third part is not shown. The 2 parts, orbital and palpebral, are shown. Third is the lacrimal part. It's not shown over here, which is of course responsible for production of the for the spread of the tears, lacrimation, lacrimal part. So this is the orbital part and this is the palpebral part. See another picture over here, right? This is the palpebral part, right? Coming from the medial palpebral ligament. It arises from the medial palpebral ligament and going to the fascia. And this is the orbital part. This is the surrounding all that side, right? So this is the layout, and you see this is the separate table mentioning only the orbital group of the muscle. This is the palpebral part, arises from medial palpebral ligament and inserted into the lateral palpebral raphe. And the orbital part arises from the nasal part of the frontal bone and the frontal process of the maxilla, and also the medial palpebral ligament. You could see these are the parts. These are the parts of the frontal bone, nasal part, and this is the maxilla bone part over here. You see the actions. This is a very smooth action, soft blinking, as occurs during normal blinking process or during sleep. This is done by palpebral part. And this is the tight closure of the size, and this is done by the strong muscle orbital part, right? And when these various parts act together, both these, so there is a closed, a tight closing of the side palpebral fissure. So this is mentioned over here. Palpebral part, it's just the blinking or sleep. During that activities, this is responsible for that actions. And this is the lacrimal part, not shown in the picture. It draws the eyelids medially and aids in drainage of the tears. And this is the last orbital part. So this is the responsible for winking or squinting and protects the eyeball against glare or dust. And I told you already, when all three parts contract, the eyes are firmly closed. So now the another group, muscle of the nose, right? So functionally, maybe not that important, these muscles. So their importance is aesthetically, for the cosmetic surgeon, plastic surgeon, leading of the nose, right? This is the in humans. It's very, very important in certain mammals like elephants and rabbits. So they can move their various positions of the nose and for smell. So this is the nasal muscles. You see, what are they? You see the table first. This is nasalis, transverse part, and the alar part. Then the procerus, and then there's a depressor septa. You see them over here. This is the procerus. This over here, coming from there to going this part. This is the procerus. You see the attachments. Nasal bone comes from an upper part of the lateral nasal cartilage. And then is a depressor septi nasia. From this arises from this part of the bone and going up to the nasal septum. This attachment, maxilla above medial linear and mobile part of the nasal septum. These are the attachments. And then very important, this nasalis is the transverse part, and this is the alar part. Transverse part comes from maxilla, just lateral to nose, and the alar part comes from maxilla or lateral inside. So this is the alar part, of course, goes to the alar cartilage, and the transverse part goes to the aponeurosis across dorsum of the nose with muscle fibers from the other side, all supplied by the facial nerve. This is the nasal muscle. You see your picture, and you can focus on that, showing all the nasal muscles. And now coming to the muscle of the ears. Muscle of the ears, very important in animals. So they are capable of cocking or directing the ears toward the source of the sounds, and very less critical in humans. Muscles of the ears. These are the three muscles. You see, this is the anterior auricular. So it comes from this fascia. This is the temporal fascia, and going into this part of the ear. This is the helix, tragus part, and this is our superior auricular part of the auricular muscles. It comes from this fascia and going to the temporal fascia. You see the attachments over here. This is the superior. It comes from epicoronial aponeurosis on side of the head. This is the epicoronial aponeurosis, and inserted into the helix of the ear. And the superior auricular coming from the epicoronial aponeurosis on side of the head and upper part of the auricle. This is the auricular muscle interior. So where does it come from? From the anterior part of the temporal fascia, I told you, and into the helix of the ear, supplied by the facial nerve. And I told you already, muscle of the neck, platysma. It's a broad sheet of muscle in the subcutaneous tissue of the neck. So it blends with the muscle of the face, and as the origin is common as of muscle of the face, from the second pharyngeal arch, motor nerve supplies the same facial nerve. It has two attachments, superior and inferior. Superior acts to form the great stress and the inferior gives a grimace. These are already discussed in the lecture of scalp, occipitofrontalis. This is the frontal belly and this is the occipital belly. Here you see the frontal belly and this is the occipital belly. So various expressions conveyed by the muscles of the face. This is smiling and laughing conveyed by the zygomaticus major, and sadness by levator labia superioris and levator angulioris, grief by depressor angulioris, anger by dilator nares and depressor septi, distress and grimace by platysma, surprise by frontalis, doubt by mentalis, grinning by razorius, contempt by zygomaticus minor. And in the last few very important applied aspects, so paralysis of the facial muscles. So injury to the facial nerve or its branches produces paralysis of some or all facial muscles on the affected site. So important is the Bell's palsy. So what happens in the Bell's palsy? There are two types of the lesions. One is this A, supranuclear lesion. This picture is produced, and the other is this infranuclear lesion. This picture is produced. This is the Bell's palsy, this infranuclear lesion. So infranuclear lesion like mostly occurs in the stylomastoid foramen. So what happens? This is the at the supranuclear level. What happens? This is the only this side, lower side of the face is affected. This the lesion is here, and it's on the contralateral side. This is produced, right? Lower part. This is the scape. This is the frontalis part of the occipitofrontalis, and then the corrugator supercilii. So this is the escape because it has bilateral representation in the cerebral cortex. These corticonuclear fibers in red, they are having a representation bilaterally in the cerebral cortex. So they are escaped. They get the nerve side from this opposite side. So what happens in the infranuclear paralysis, which is the Bell palsy? You could see the lesion is produced at the stylomastoid foramen, and this happens. You see the whole side of the face. On this side, the same side is affected. So what are the features produced? You could see clearly in the next picture. Here you could see what this is. One, what is this? This is the frontalis has a raised eyebrow. This you see. And number two, the buccinator over here has retracted the lips. And number three, the platysma is in moderate contraction. And on this right side, the lower eyelid is drooping due to the paralysis of the orbicularis oculi. This is a rough picture of the Bell's palsy. So what will right side paralysis is that? So what will happen? You can see over here, right? So there would be no wrinkling on the affected side. This is the affected side. The wrinkles would be absent because this muscle is gone. Frontalis. Then what happens over here? There is no blinking of the eyelid, and the current lacrimal fluid is not spread over the cornea, and it leads to ulceration of the cornea, dryness, ulceration. And the third is this: the mouth is retracted to the opposite side of the face. This is the Bell's palsy. Treatment is due to the corticosteroids. And if there is buccinator and orbicularis oris injured, the food accumulates in the oral vestibule, and continually required is the removal with a finger. If there is injury to the lip muscles, one cannot produce labial B, M, P, or W sounds. Ba, ma, pa, ba. No whistling, no blowing. So there would be frequent dabbing of the eyes and mouth with the tissue paper and handkerchief. So this is the flaring of the nostrils. So this is a very insignificant action of the this muscle around the nose, but sometimes it gets very important because it due to the static reasons. And the habitual mouth breathers, for example, there is diminishing and elimination of the ability to flare the nose. It can lead to dental malocclusion. And in the last, there is squamous cell carcinoma of the lip due to overexposure to sunshine and pipe smoking. So this is the area, this is the squamous cell carcinoma. And here you could see from this area, the lymph goes to the submental lymph nodes. And from this area outside, it goes to the submandibular lymph nodes. With this, I stop and end this lecture on this muscles of the face. We'll do a lecture on arteries, vessels, another one on the nerves of the face, and then we'll be moving to dural venous sinuses. So this is, I thank you very much for listening and being here. Goodbye.